Welcome back to another episode with ByrdAdatto. Throughout this week, we're really trying to help plan actions for you guys as to how to get reopened. Some of you guys are open, some of you plan to get open, and so throughout this week, we have different special guests who are going to come in and talk about different pieces. And one of the things that, as a medical practice, that you have to have is patience. Without your patience, you really typically can't make much money. And so because of that, we brought in our special guest. And Michael, can you please introduce our special guest today?
Well, for many of you out there, Mara needs no introduction. Those of our client base surely know Mara Shorr with Shorr Solutions. Mara and her father, Jay Shorr, are partners at Shorr Solutions. We've known them for years. We speak on the same circuit around the country at the different medical conferences. And they are well respected in the industry for their consulting advice they give to clients. We share many mutual clients, and we're honored that you're with us today to share some wisdom.
Thank you so much. I'm so happy to be here. I know the three of us talk a lot in general, and sharing opportunities and just sharing different components. And I know that we've all had more conversations than ever before during this very short time, but during COVID, about how we can all do this together. So thank you so much for having me today.
Absolutely. Well, Mara, I know that you're in Florida, but you have clients all across the country, and I know you've been having a lot of conversations with them about opening. Would love to hear your thoughts about what you're advising your clients as to what are the things they need to be thinking about and how they communicate with their patients before they walk in the door.
Absolutely. So one of the things that we're telling our patients, because we're telling our clients rather, and we're separating it out into two different components. One is on the marketing side, and we're not going to get into all the different marketing components, which could be a whole other separate conversation, but really talking about theme of the messaging. And so if we break it down into two separate portions of the answer, one being marketing and the other being general patient communication with the one-on-one. And what we're telling everybody is that safety is more important to communicate now than ever before. And so anybody that's ever done any sort of studying as far as Maslow's hierarchy of needs, as far as the pyramid, we know that the very base, the very foundation is safety. And if our patients don't feel safe, and right now, as a population, we haven't felt safe for several months. That's been a huge issue. And so what we're doing is we're really encouraging our practices and the practices we work with on a consulting basis to communicate all that they're doing as far as safety. Talk about sanitization, talk about removal of your waiting room / reception area where you no longer have chairs that are back to back to back. Talk about how you are calling or texting patients when their appointment is ready. Talk about how you're eliminating traffic in a hallway so that they can maintain the distance of 6 feet apart. Talk about sanitization, all of these things. And what sounds like a strange thing to communicate in marketing copy, where honestly, if you would have asked me 3 months ago, if I would say, you know what you should do, make a boomerang of you wiping down all your machines and your doorknobs. That's great marketing copy, is wiping down doorknobs. If I would have said that 3 months ago, you would have thought I was out of my mind and kicked me off this video right away. But this is what people want to know, right? So I really urge you to communicate that above all else, because that is what's at the forefront. On the other hand, what we want to make sure we're communicating is that every single member of your team that you currently have, whether that is one person or whether that's 10 or 15 people that you've now brought back, I encourage you to have every single team member picking up the phone and making phone calls to your existing patients and not waiting for patients to realize that you are back open, and that not waiting for them to think, oh, now I should come back for this particular treatment, for my injectable, etc. But more importantly, make sure that you have scripts. We have been giving scripts we've been handing out like candy to our clients, all of the scripts for every single team member about scripts about safety, scripts about how patients are overdue for treatments, scripts when it comes to bringing them back for their annual exams if they're an insurance-based practice. But what you want to make sure is that every member of your team is equipped to answer all of the questions that 2 months ago they would never have gotten a question. And we use this as a funny little example, but it's true. How often are you sanitizing your doorknobs? That's not, I mean, again, it sounds preposterous, but when we talk about what safety measures, I don't know if I feel safe as a patient coming back, that's not something that would have been said 2 months ago. So you want to make sure you're arming every single team member with scripts and that you are making sure that they are making those outbound calls, because you can't rely on patients at this point to only make those inbound calls. You need to make the outbound calls as well.
I love it. And, what I hear is a common theme we've talked about through these videos. One is we talk about not being tone deaf during this time. And it's really just meeting the patients where they are and recognizing,
Exactly.
The safety now. And then the other thing I really liked that is so important is just the recommendation for a proactive approach rather than a reactive approach.
Exactly. And what we need to think about are, just like you said, Michael, in the spirit of not being tone deaf. If you're simply, excuse me, if you're simply throwing up before and after photos on your social media and not acknowledging that we have just been through something as a world, not just a nation, but as a world, we have just been through something horrific. And to not acknowledge what we've just been through and to think, oh, it's business, not even as normal, business as it was 2 months ago, is almost like you said, it's being tone deaf. It makes you seem like as a practice, you have your head in the sand. And that doesn't come off well either. So we need to make sure we're acknowledging the sentiments of the people that are reading the marketing on the other side. I even encourage, send out regular email communication about what you're doing differently and as a practice, and also letting patients know you're back open. And so we've worked with practices time and time again on crafting this copy, because it's difficult to know how to put what you're feeling in here onto a piece of paper. And so we've been working really hard with our clients to help them communicate that well. But not being tone deaf is such a crucial thing and such an important way to put it.
Love it. Yeah, I mean, you hit on so many important aspects of how you communicate with your patients and making them feel, and I love the fact that you're using safety. We have said the same thing, so it's so funny. We often we have great minds think alike with the safety first when it comes to everything. And I love the fact that that's the way in which you need to make sure that the people walking in your front door are going to be fearful as to how they can either catch it or and you're making it easier for them to understand all the things that you've done to make your place a safe spot for them. So it's great advice. Mike, I don't know if you have anything else?
Don't.
Well, again, Mara, thank you so much for spending the time with us today, and we appreciate it.
Yeah, thank you.
Thank you so much for having me. It was great to be here with you guys today.
Perfect, and we look forward to the next episode, and we'll continue through this process talking to you about all the different aspects of what you need to do to get yourself prepared to reopen.
Perfect. Thank you.